in order to answer that question from an ethical standpoint, we have to understand that this is a little bit of an implicit, sometimes explicit, but mostly implicit renegotiation of a social contract. All the governments in the world right now are asking their population to greater or lesser degrees to make sacrifices, to change their behaviors, to choose things they would not have chosen otherwise, in order to protect public health. And reciprocally, in compensation, the governments are promising as much as they can to protect the health of the population, the physical and mental health of the population, to protect citizens' basic rights, and also to provide some form of a bridge to reach the end of the pandemic as intact as possible. And intact here means physically intact. It means with links and relationships as intact as possible, and also social cohesion. And so in order to see whether our authorities' response is sufficient and effective, we have to look at all of this. And if you look at all of this, you see that in most places in the world, we could do things better. And right now, Switzerland is doing particularly poorly. Right now, as we speak, it will perhaps be different next week, but this week, Switzerland is doing particularly poorly in terms of epidemic control. It is doing rather well in terms of the protection of fundamental rights. It is doing sort of halfway in terms of social cohesion, and the protection of a bridge towards the other side of the pandemic is another chapter where it is rather good, because there's been a lot of protection, financial and legal and social protection for individuals, which has helped many, but which has not prevented things like bankruptcies and small businesses having to close down. And so on that last chapter, although we do better than many of our neighbors, we could do even better still. So I would give a sort of halfway grade, and the grade sort of depends on which parameter you are looking at. Because if you're looking at the number of infections right now, we're not doing well. If we're looking at other parameters, we're doing better. And the question, the $100 question is, what would have been the solution to get all of them right? Because this is what we would all want, to get all of them right. When we say lockdown, we mean very different things, actually, and different countries have not implemented the same actions when they speak of a lockdown. So, for example, officially here in Geneva, where I am speaking to you right now, we are in lockdown, but we are in a form of lockdown that will be unrecognizable as a lockdown to the population in Madrid or Barcelona. We are allowed to leave our homes. There is, this spring, there were drones that would stop citizens on the street in Spain, asking them what they were doing. We don't even have to justify the fact that we're going out. There are places that are still open. So it is a very different thing from what another country would call a lockdown. The best option, in my opinion, is the one that can affect the required effect while costing the least in terms of basic rights, and while also enabling the economy to work as well as possible. And this means that in some circumstances, yes, a lockdown will be the best option. Even on the economic side, actually, this is something that is abundantly shown by the data from our economist colleagues, is that actually the very worst thing for the economic health of a country is the pandemic that is out of control. This is the true poison against the economy. So if you have a situation where a lockdown is the only thing that will work to bring cases down, even from an economic standpoint, that's what you ought to do. But the question is always, will a softer measure also work? Because if a softer measure will also work, then it may be preferable. What we want is a measure that is effective, and it is not necessarily the case that a more stringent measure will be more effective. We all have this intuition that a more stringent measure will be more effective, and it can be, but actually in many cases that's an open question. During the first wave, countries that had soft lockdowns or hard lockdowns, the data didn't really pan out to show that harder lockdowns were more effective than softer ones. And so we are looking for the most effective measure, and it will not necessarily be the most stringent one. Why not isolate only vulnerable people? Well, for two reasons. The first reason is that it does not seem to be practically possible. Our societies do not function in such separate spheres. And this has been modeled again and again from the beginning of the pandemic, that if you try to place the different categories of the population in silos that do not come into contact, in the end, it always breaks down. You need just the slightest little fissure and you will have the epidemic that starts again in the silo next door where you have tried to isolate your vulnerable population. So there's a pragmatic argument against that. There is also a moral argument against that because, of course, if you are isolating only the vulnerable, let's imagine just for a minute, for the sake of argument, that it was possible. If it were possible, what would it mean in practice? It would mean that you would tell everyone who is not vulnerable, go ahead with your life, go ahead with the goods that you find in life, with the exercise of your rights, of your choices, everything that we usually think everyone should have access to. And we tell the vulnerable, you put that on hold for we don't know how long, perhaps for years. Some of you, it will be the rest of your lives. And you put that on hold because we would rather not make the efforts of making society safe so you too can exercise your rights, pursue goods in life, and do everything that usually everyone should have access to. But in the end, our societies are not really there for any other reason. Our societies are there to enable us all to make choices, to exercise rights, to live our lives without too much risk. And COVID changes the circumstances, places us in the face of an additional risk, which is quite a consequent risk as well. And this means if we want our societies to continue with their primary function and enable us to exercise our rights and make our choices without too much risk, there's a lot that we need to reorganize so that it still works in the face of this threat. But if we isolate the vulnerable, we tell them you don't matter enough for this basic functioning of our society to work for you as well. We would rather you put everything on hold, you put your rights in parentheses, you put your pursuits and things you want out of life in parentheses, perhaps for good, because some will die during the pandemic, because we just can't be bothered. And this is deeply problematic. It's truly deeply problematic. Triage is not about deciding who lives and who dies. The way that triage is done, and it's a very venerable and old practice in medicine, is that you target the middle. So if you imagine street lights, if the light is green, it means you'll be okay with or without the resource. You don't need the priority. If the light is red, you're doing poorly, your prognosis is bad, but it's bad probably with or without the resource again. You won't be helped that much because your chances are you'll die anyway. Orange is the light that can switch to either green or red. And this is where if you don't get priority, you're likely to die. But if you get priority, you're actually likely to live. And this is where you get priority. And by doing that, the act of triage respects two very important principles. The first one is it tries to save as many people as possible, to save as many lives as possible in a situation where there are so many simultaneous victims that it will not be possible to save them all. But it does try to save as many as possible. And the second one is it honors, it respects the equal value of everybody's life. It doesn't give more weight to someone because the activity of that person will be more important or because their value to the doctor is higher. There is none of that on the radar. The only criterion here is what are your chances with or without? It's the short-term prognosis. And it's a hard activity, first because you have to be as exact as possible and there is always uncertainty. So there's always the risk of getting it wrong, but you have to get it as right as possible. It's also hard because in those situations, you know that there are people whom you might have been able to save had circumstances been otherwise, and that you have to just not try to save. And that is really hard. It is a psychologically devastating situation to be in for health professionals. And this is one of the reasons. The other one, of course, being that we want to save more lives if we can. These are reasons why we really ought to try and do everything we can to avoid being in the situation where triage becomes necessary. But if it is necessary, it is not a failure of medicine. If it is necessary, it is one of the most demanding tasks of medicine for which our teams are trained and very good. it is a failure of public health, actually. It is a failure of prevention if we get into the situation where triage becomes necessary. There are very, very deep issues related to international distribution and indeed national distribution as well. Some of them have to contain a commentary about the fact that we've had something that could be called dress rehearsals, right? Situations where a pandemic didn't happen but could have done so, and where there were issues about international distribution that did not go that well. So since then, there have been international treaties and texts by WHO and commitments by countries to do better next time. So here we are, next time. And we shall see how well these work in practice when vaccines, hopefully more than one, become available. But what we see currently is that some countries look like they want to practice so-called vaccine nationalism and give priority to their own population. What we see also is that despite agreements like COVAX, there has been preemption by rich countries of many of the potential doses of many vaccines. And so it's likely that unless more is available than is planned, or unless something else changes, there will be this problem of distribution between rich and poor countries, as would not be entirely surprising. So one of the things pandemics do is they are great revealers, right? They show us our image in the mirror. They show us where we do well and where we do less well. If a few years ago, someone had predicted there's going to be a pandemic, and it will reveal that international institutions are really good at being completely fair towards everyone in the world, we would probably have had trouble believing that, right? Because all our experience shows us that although progress has been made and although many things do work, many other things do not work so well. And so it will not be surprising if there is this difficulty. I have to say also on the question of the distribution of vaccine, that many things may actually, more than we think now, may depend on the characteristics of the vaccine. So here we've just had this announcement by Pfizer BioNTech about the intermediate results for their vaccine. And it so happens that this is a vaccine that needs to be preserved at a very low temperature with very high-tech freezers, which you can only take it out of a certain limited number of times. And this, of course, has a very obvious impact to how you can distribute it across the world. There are other issues that are more technical, perhaps, that will also have such an impact. So, for example, many of the vaccines we already have for other diseases prevent not only disease, but they also prevent transmission. And a lot of how we think about vaccine distribution hinges on the fact that once you're vaccinated, it's not just that you won't be severely ill, but you will not be contagious either. It's not a given that a COVID vaccine will have the same characteristics. If you have a vaccine that prevents you from being severely ill, but still lets you be contagious, then the distribution will not be the same. The best distribution will not be the same as if you have a vaccine that also prevents transmission and so on. I don't really think it does, actually. I think what it does is it changes the visibility of different issues, but these are not entirely new issues, right? There is a whole field on the ethics of public health that was already thriving before COVID-19 and which seems now to have the most contributions to give to ethical issues raised by this pandemic. But these were questions that were discussed before. There are questions around the interface between individual choice and collective responsibility and collective goods that are very, very old and venerable questions. So many of the questions we have around the measures for prevention are about how much may I choose to put others at risk. If I have to endorse a burden, even a small one, like wearing a mask is not a very large burden, but it is for many people somewhat of a burden. How much of this burden should I shoulder if it is for a collective good? And of course, in this case, the proportionality is very clear. It is a very clear public good and it is a very small burden. But in practice, this weighing, this tension between a personal and individual burden and the collective good is one of the oldest unresolved questions of political philosophy, if you look at it closely. So in this case, luckily, the relationship, the proportionality is there, and it's clear that yes, it's okay to have mask mandates. It's better if you make masks accessible to everyone by not making them expensive or perhaps making them free, of course, but this is twiddling around the edges. It's not the fundamental question. The fundamental question is clear, but there are many of these issues that become more visible, but they are not in themselves new.